Meniere's disease is a disorder of the inner ear. It can cause severe dizziness, a roaring sound in your ears called tinnitus, hearing loss that comes and goes, and the feeling of ear pressure or pain. It usually affects just one ear. It is a common cause of hearing loss. Attacks of dizziness may come on suddenly or after a short period of tinnitus or muffled hearing. Some people have single attacks of dizziness once in a while. Others may have many attacks close together over several days. Some people with Meniere's disease have drop attacks during which the dizziness is so bad they lose their balance and fall. Scientists don't yet know the cause. They think that it has to do with the fluid levels or the mixing of fluids in the canals of your inner ear. Doctors diagnose it based on a physical exam and your symptoms. A hearing test can check to see how it has affected your hearing. Symptoms. Signs and symptoms of Meniere's disease include recurring episodes of vertigo. You have a spinning sensation that starts and stops spontaneously. Episodes of vertigo occur without warning and usually last 20 minutes to several hours, but not more than 24 hours. Severe vertigo can cause nausea. Hearing loss. Hearing loss in Meniere's disease may come and go, particularly early on. Eventually, most people have some permanent hearing loss. Ringing in the ear, tinnitus. Tinnitus is the perception of a ringing, buzzing, roaring, whistling, or hissing sound in your ear. Feeling of fullness in the ear. People with Meniere's disease often feel pressure in an affected ear, oral fullness. What causes Meniere's disease? The cause of Meniere's disease isn't known, but scientists believe it's caused by changes in the fluid in tubes of the inner ear. Other suggested causes include autoimmune disease, allergies, and genetics. Complications. The unpredictable episodes of vertigo and the prospect of permanent hearing loss can be the most difficult problems of Meniere's disease. The disease can unexpectedly interrupt your life, causing fatigue and stress. When to see a doctor? See your doctor if you have signs or symptoms of Meniere's disease. These problems can be caused by other illnesses, and it's important to get an accurate diagnosis as soon as possible. Diagnosis. Your doctor will conduct an exam and take a medical history. A diagnosis of Meniere's disease requires 2 episodes of vertigo, each lasting 20 minutes or longer but not longer than 24 hours. Hearing loss verified by a hearing test. Tinnitus or a feeling of fullness in your ear. Exclusion of other known causes of these problems. How can physical therapy help in the management of Meniere's disease? Between spells, patients with dizziness, visual blurring, or imbalance are referred to physical therapy. PTs can help improve these problems with balance and gaze stability exercises. You need to stay physically active between attacks. If a patient has injections or surgery, there will be no more spells, but the patients will need rehabilitation to improve their balance and dizziness. After discharge from PT, it is important to continue physical activity such as daily walking and home exercises to make sure that your risk for falls or dizziness does not return. General physical therapy management as we do at therapy consultants includes customized protocol depending on the presentation of each patient. Contact a vestibular rehab therapist who will be able to evaluate your specific condition and impairments, then plan appropriate vestibular rehab in coordination with your referring physician to manage your situation. Now, if you enjoy this video, please don't forget to like and subscribe.